All right, good morning, everyone. Get my slides pulled up here. Is everyone able to see my slide?
Thank you, ladies. Nice to meet you.
Sorry we couldn't pay too much attention.
I was gonna catch you up.
Thanks.
All right, good morning, everyone. Like Mark said, my name is Catherine Hines, and I'm a research project manager at the Kentucky Injury Prevention and Research Center. We are located here at the University of Kentucky's College of Public Health, and we are also a bona fide agent for the Kentucky State Department of Public Health. And today I'm going to be presenting on timely linkage to care and resources, which will be primarily going over the findhelpnowky.org website. So let's get started. The objectives for this presentation is threefold: to review the web-based tool for linkage to substance use disorder and/or mental health treatment and recovery, apply strategies and approaches for assisting linkage to care resources tool, and then identify and interpret recovery ecosystem resources for treatment and recovery. So to get started, I'm going to give a little bit of a background on our website. So we partnered with the Kentucky Department of Public Health, as well as the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities. And the goal back when we first started this project was to create a website that people could go to find substance use disorder treatment with available openings. So it's near real time. We work directly with our treatment providers across the state, where they are required to update their available openings on a scheduled basis in order to stay published on the website. And I'll show you, we're going to do a whole website demo, so you'll get that idea. But we started this project. The initial development and brainstorming of the whole process started in 2016, and we've been working on it ever since. Like I mentioned, we started with just substance use disorder treatment. In 2022, we added recovery housing as another resource that we built into the website platform. And then most recently, last year, we added mental health treatment, as well as a comprehensive directory of community-based resources. So these are going to be resources like housing, financial assistance, transportation assistance, that kind of thing. And then we also partnered with the Kentucky Department of Health's harm reduction team, and we have linked to their naloxone website, where you can find naloxone distribution locations as well. So let's get started with the demonstration. And I think if I just pull this over, are you all able to see the website now? Or are you still seeing my PowerPoint? Okay, I'm going to assume you can see the website. So this is our landing page, where we have kind of the blocks of treatment options or recovery housing options. And here on the left-hand side of the screen, we just have some basic information, links to 988, both the phone number and the chat option, as well as some of the other substance use disorder specific hotlines that or call centers that we have. The Kentucky Help Statewide Call Center that's run through Operation Unite. There's also the Kentucky Opioid Assistance and Resource Hotline link there. And then I'm going to start with some of these items up here on the top before I get into actually doing a search. So if you're interested, we have a learning materials section, and this is developed. It's a combination of one-page documents that our team here at KIPRC has developed, as well as some other resources that we've added. But it's all based on a variety of topics related to substance use disorder, recovery housing, and mental health. And we have these filter options here. So for anyone looking for some different educational-based resources, you can also filter it by audience. So what that resource or the learning material is geared towards. We have some additional resources there. We also have our products and publications, which are like our marketing materials. So these would be stickers, brochures, pocket cards, that kind of thing. Um, we work with a lot of emergency responders to try to get these items in their hands as well, so that when they're called out, they have a resource to give the people that they're working with. Um, and then basically just our glossary, which is not exciting, but if you see a term on the website that you're not familiar with, you can go there. And then I'll do the community resources demo next. So this was just built last spring. So we worked with the community mental health centers who have been taking the 988 calls once that launched a couple of years ago. And we learned that all of the community mental health centers, the call centers have like different resource guides that they had. And you never know if you're going to be getting a phone call from someone who's actually in crisis in your region, or if they're outside your region in another area of the state looking for resources in an area where you may not be familiar with what's available. So that's why we came up with this community resources tool. So you can type in a city or a zip code, and then you click search. And the default category is basic needs, but you'll see here that there's a whole list of categories here. And we have, I think, total a little over 2,000 resources that are currently on the website. And we are adding to that list every day. We have a whole team that's dedicated to vetting community resources, ensuring information is accurate and up to date, and then before it's posted here. So within each category, we have topics. So these are the different topics. Someone's looking for food assistance. And it's just some basic information. It's the address, phone number, website. And then if there are some of these resources cater to or address specific populations. And so that can be helpful too when filtering. You can also see where they are located on the map. But these are the different categories that we have. And again, this was just launched, and we are updating it regularly, and also hopefully going to be expanding the category list as well as the topic and population list to allow this search to be more functional. But that's kind of the basics of it. If you want to recommend a resource that you don't see listed on here, or if you find an error with any of the resources, you can click this link here, fill out a form, and that form will go directly to our team, who can then address the concern. So that is the community resources section. Are there any questions or comments on that before I move on? Okay. These other tabs up here are pretty basic. Frequently asked questions, about, which just gives our funding. We're primarily CDC funded. And then we do also have some additional funding from the Department of Behavioral Health for specifically the mental health treatment and the community resources side. And then if you have any questions, concerns about the website, you can fill out this form. And like I said, that again will go to our team. So let's get started with the search. I'm going to start with substance use disorder treatment. So you click Start Search. And these are what we call our entry-level search filters. So it's asking who needs help. And this doesn't have, answering this question doesn't have any impact on the search results that you see, but rather it allows us to get an idea of who is using the website. So if someone's searching for themselves, if they're searching on behalf of a friend or loved one, or if there's someone who's in kind of some sort of a referral or linkage role, they can click the client or patient option. We also have gender options, and then whether or not the individual looking for treatment is pregnant or postpartum, or may also have a co-occurring mental health diagnosis. And again, you type, all the searches are location based. So you're going to see the facilities that are closest to you first. We also have treatment type options. And since this is just the entry-level search filters, These are just going to be, these are broken down further on the next page, but these are the main categories that we have. You're not sure what someone's looking for. We have this help modal, which pops up and gives you a definition for each of the various treatment types. And then we also have payment types. So if you know the person's payment method, this can be helpful too to help narrow down the search results. Once again, if you're not sure what some of those are, we have the help modal there. So you click Start Search, and it is going to show you all of the facilities. Again, it's going to filter by facilities that are closest to the location that you entered. If you're working with someone who doesn't want to be at a treatment facility in their area and they want to go farther away, you can also sort them by those that are farthest away. And we also work with the state of Tennessee. They also have Find Help Now in their jurisdiction. So sometimes that can be helpful if you're working with someone who's on either the southern border, or even if you get a call from someone who's located in Tennessee, you can see their treatment facilities as well. So I'm going to talk about first some of the additional filters that we have. So we have a very long list of different populations. So starting with age, gender, and then some of our priority populations, first responders, veterans or military, healthcare professionals, a preferred language. These are a list of some of the common disabilities that facilities can cater to or can prioritize, and then correctional or legal involvement. Here's again the payment and insurance options, and like on the first page, but you can see that they're broken down into more specific options. So instead of just Medicaid, you can select a specific MCO that person may have. And with every filter that you select, the list of facilities that have available openings is updated right when you select a new filter. Similarly, for the treatment types, those broad categories that we had on the first page are broken out into more specific treatment types here. And then additional treatment services that a facility may offer, as well as just broader additional services. So these are what we call wraparound services. So that could be housing assistance, it can be domestic violence services, transportation, parenting classes, those kinds of things that oftentimes go hand in hand when someone is searching for treatment. And then facility type. Also, if you know the name of a facility that you're interested in looking to see if they have availability, you can use this free text search box and say, I know that I want to find a Sparrow Health that's in the area. You can type in Sparrow Health and it will pull up those facilities that have availability. So I think in total we have, I want to say close to 100 different search filters there. And again, those are just designed to help you narrow down the search results to meet the specific needs of the person that you're working with. So if you look here, we have what we call the facility profile card. So this is kind of the quick overview. If you see this green dot, it means that they are currently accepting patients. We sort facilities by facilities that have availability, and then those that are closest to you. So if you scroll all the way down to the bottom of the list, you likely will see some that have a red dot because they are currently full and not accepting new patients. But we've got a summary of the facility, again, the phone number, contact information, specific policies as to populations that they serve, and then services offered. And then if you click on the title of the facility, you'll see much more information. So you'll see the broader information there. You can also print this information. If you click on this phone number, it will pull up whatever phone app that you have, whether that be on any kind of mobile device. If you click on the address, it's going to pull up Google Maps link. you can see here that facility hours. So hours that they're open. You can see the population served, the service type that they offer. So that's either going to be substance use disorder treatment, mental health, or recovery housing. And then the treatment type specifically that they offer. And then payments and amenities here at the bottom. So if we go back to search results, and you're working with someone who needs mental health treatment, you can either go back to the landing page or you can use these check boxes. If you check both of these boxes, then it's going to show facilities that offer both mental health and substance use disorder treatment in the same location. If you obviously one or the other, you're going to see facilities that only offer the one. But it all functions the same way. And then recovery housing is new to this platform. So in 2022, we launched Find Recovery Housing Now, ky.org, where it was, if you clicked on recovery housing on Find Help Now, it took you to an external site. And actually just last month, we integrated the recovery housing website into this platform. So it's all now a one-stop shop for any of those three items, which has been really helpful. So for recovery housing, and I could have mentioned this for substance use disorder and mental health treatment too, but we only onboard facilities or houses that are licensed or certified. So with substance use disorder and mental health treatment, there's a lot of different certifications available to them. And we use those license and certification lists to vet the facilities before we onboard them, as well as to do our outreach. With recovery houses, they are, there's something called the National Alliance of Recovery Residences, which has been kind of the national organizer for certifying recovery houses, since there are unfortunately a lot of bad actors when it comes to recovery houses, and that goes for really any of these. But this way we are able to make sure that the houses that we are recommending or putting forth for people to search for, that they have been licensed through the state. So you're only going to see facilities or houses that are certified, and they have a lot more filters. So you'll see this walkable places filter pops up, as well as the structure type. So this is going to be the type of house that's available. And then this is a little bit of information about their application process, which can be really helpful when searching for a house. But just like a treatment facility, you can see the location, you can see total number of beds and baths that house offers. You can see what level of certification they have. And then again, similar transportation, the contact information. Some houses don't have a website like a treatment facility would. So we include their email as a way to contact them instead. And then for privacy purposes, safety reasons, houses can opt in or out of showing their privacy, or I'm sorry, first showing their address. So if a house hides the address, you can still know what city it's in, but without contacting them directly, you won't know exactly where they're located. Similar to a treatment facility, you can print this information and then scroll down and see all of the services that they offer, what their accreditation and licensure is. And then you can see the payments and amenities is a little bit different on this page. So whether or not fees can be paid biweekly or if they're monthly, each house gets to decide that. And then amenities that house offers. Some additional residential requirements, correctional history as far as what residents they'll accept, and then the additional services and programs, where this list can be very comprehensive and very long for some of these houses. We kind of sort them this way, showing facilities that are, or I'm sorry, services that are offered directly within the house, Offsite services are typically services that the house can partner with, where residents will still have access to those services, but they will have to physically leave the house in order to get to these services. And then some additional locations that are within walking distance. So that is recovery housing. Are there any questions, concerns, comments about any of these items? Or how the website works? We work directly with a software developer here in Lexington called Apex Software, and they are the team that built this website and have been working with us for the last 9-10 years. And so it's a fully custom website. And so any input that we receive from people who use the website as a referral tool, we can receive that information and go to our software team to request updates or enhancements. So if you all start utilizing this in your call centers and find any issues or ways that you think it could be improved, I'll have my contact information up here in a second, and you'll be able to reach out, or you can also use that contact form within the website directly. So if there are no questions about the website, we'll go back to our slides. I've got a few more left. So I wanted to give a quick overview of some website analytics. So for findhelpnowky.org, which is kind of the original substance use disorder website that has been around the longest, we've had over 520,000 users who have completed almost 300,000 searches. And then for mental health, which is brand new, we've had just over 2,000 users perform over 3,000 searches. And then for recovery housing, which kind of came along in the middle back in 2022, we have seen over 31,000 users perform just over 32,000 searches. So it's pretty well used. The analytics that we collect from the website are just filter options. So we can see like how many times the outpatient filter has been selected. We can see how many times someone's searching for some of those additional wraparound services. And what that allows us to do is identify where the needs are for people across the state looking for treatment and recovery housing, to ensure that we work with our partners and make sure that the needs that are being requested through the website, that we have enough of those resources to meet that need. And so one of the ways that we're able to identify, well, how do we know if we have enough, is on the back end of the website, we do collect the total number of treatment slots, as well as how many slots are available at any given time. And that is the part that the facilities or the recovery houses have to go in to the website directly and update. So we try to get all the facilities to update roughly once a week. And if they do not update within that time period, then we can unpublish them from the website, which means we don't lose any of their information, but their facility or their house will no longer show up in the search results when someone is performing a search. So that's kind of how we encourage them to participate. There is no requirement that facilities or houses participate in the website. They don't pay any money to be onboarded to the website, to be listed. And so that is kind of our way of encouraging them to update and making sure that we have accurate listings, and that's near real time. And then we typically keep between an 85 to 95% participation rate of all of the facilities and houses that we've onboarded over the years. So our facilities are very good at updating and keeping their listings available for when people are searching. So some of the advantages for using this platform for navigators and call centers who work with populations and needs of these types of treatment and resources, This is just a way to improve the timely access to available openings. Before Find Help Now launched, you could Google search and, or if you know of what's around in your area, but this way, that process can take a lot of time. And so this speeds up that process for those who are looking to help people looking for these resources. Enhance coordination and efficiency so you can efficiently manage resources, reduce duplication efforts, and ensure that the services are evenly distributed. And then, like I mentioned earlier, the data-driven decision making that we can do because of the information that we collect on which filters are selected, as well as the capacity and the availability of those resources for different geographic regions, and based on what people are searching for, allows us to ensure that we can identify gaps and fill those gaps where needed. And overall, just enhance public health outcomes. So being able to have a one-stop shop where you can find treatment, naloxone, recovery housing, all in one place, as well as those additional community resources that we've built into the platform have proven to be really helpful for individuals searching. So that's about it. Here's my contact information. I will also include it in the chat. So I would love to hear feedback from any of you all, and I'm happy to answer any questions that you all have. All right. Well, thank you all so much for your time today. And I hope that you all are able to find Help Now helpful and useful to you all, and look forward to getting any feedback that you all may have.